When we're in primary care, time is usually a limiting factor as well as resources, and we're dealing with older adults with multimorbidity, and it can feel very overwhelming. Um, and they may have a checklist of 10 things that need to be addressed, maybe in a 15 to 20-minute visit. So when we approach primary care in our multimorbid adults, we should have a plan. So there's different models of how we can approach this. The first one on this slide is the comprehensive geriatric assessment. And this is the most time consuming and could be piggybacked on top of the Medicare wellness exam, possibly. It requires physical health assessment, cognitive mental health assessment, screening for functional abilities, and also socio-environmental factors. This is resource intensive. It usually is several disciplines within the visit, and it is probably the most challenging to do. The second one on this slide, the brief geriatric assessment, is a more realistic or manageable assessment that can be done in your usual primary care office. It has targeted screening for functional ability, cognition, fall risk, nutrition, mood, and depression screening. A rolling assessment is sort of the comprehensive geriatric assessment that is broken up over several visits, which makes it more manageable and, well, just less overwhelming for the patient and the provider overall. Sprinkled throughout these three modalities, you have the ability to utilize self-administered questionnaires that can be in the form of a pre-visit form or a triage form that gives you some guidance of what may need to be addressed in the patients. Another thing about these questionnaires or surveys, they also can be administered by non-physician team members, which can sort of balance the load for your primary provider. So for a comprehensive geriatric assessment, it would cover all of these domains that our multimorbid older adults would require to have assessed. We would take a look at their physical and mental conditions, which includes a medication review, nutritional status, clarified problem lists, assessing mental health conditions in terms of cognition and mood, as well as the related maybe feelings about their function or kind of adapting to that. Their functioning itself, their mobility, these things are things that need to be assessed to understand how they can continue to take care of themselves as well as perform their activities of daily living. Their social and environmental circumstances, these can greatly impact how they can take care of themselves, how well they can participate in meeting their physical, mental, and functional goals. This is why a comprehensive geriatric assessment would be best done as a team-based assessment. It has a lot of components, it has a lot of things to be covered, but it would definitely provide all the information of what would be prioritized and what can be highlighted to prevent further decline in a patient. The brief geriatric assessment is sort of a targeted assessment that evaluates physical function, cognition, mood, and nutrition, and sensory impairments. It'll also incorporate these self-administered or in conjunction with the patient surveys that can highlight what needs to be addressed. There's something called the Rapid Geriatric Assessment, and it screens for frailty and sarcopenia, anorexia, and cognitive impairment. It is very quick and gives you some information that can guide your approach for treatment in a very complex patient. The brief geriatric assessment for general practitioners is, again, a short assessment that takes into account hand grip, 6-meter walk test, a brief cognitive screen and mood questions, sensory screens with the Rene test and Snellen chart and BMI. And this can be incorporated into their triage or, done with a non-physician provider and is less than 10 minutes to administer. It will give you a lot of vital information in your primary care visit with your older adults. Another brief geriatric assessment that it takes about 20 minutes is the BAT tool from the Active Geriatric Evaluation program in Switzerland. It takes into account sort of these core geriatric syndromes that may provide insight to unmet needs, and that way we can address them in a way that is either proactive or preventative. The 10-minute targeted geriatric assessment was an assessment that was done in a prospective cohort study of over 700 older adults with multimorbidity that required sort of hospital level care for non-surgical interventions or treatment. And it screened for these areas of socio-environmental and also cognitive screening, as well as nutritional status and functional status. And it did show those that scored higher on this, that they had a higher 1-year mortality. Using this information, it may highlight those patients that need more attention, that there are certain areas where their needs are unmet, and if they are met, we can reduce their overall sort of chronic conditions as well as mortality in this case. The Easy Care tool is something that provides a structured way of assessing older adults in order to identify geriatric syndromes that may require more attention or proactive care. There's sort of the Easy Care Standard 2010 that can be administered by a trained non-physician, and then there's more recently a 2-step that can be sort of broken up into 2 parts. But it takes into account these domains in a patient's life, and it can help you focus on areas that need to be addressed. This slide shows some of the self-administered surveys and triage and screening tests that can be utilized by various team members in order to sort of target what is going on with your patient, what should be prioritized, and what needs maybe some proactive attention. So in many practices, I think rolling assessments are probably the most realistic and beneficial or fruitful kind of way of approaching primary care assessments, adapting this comprehensive geriatric assessment, making sure that key domains are screened incrementally across multiple appointments, and allows you to focus on the complexity of the patient's issues and manage the time restraints that you may have and the burden of having a lack of resources.